Welcome everybody. We're doing a Q&A session today for IVF Australia, and today we're talking about lifestyle factors and things that could affect your fertility. So what I'm going to do, I've got a few questions that have already been sent through to me privately. So we'll start with some of those. The first question I got was about supplementation. Whether Elevate is the best option or there are other options out there. I think with multivitamins, what we need to think about is all the ingredients that are in them and I guess to a certain extent what the evidence behind each of these are. The most important thing in any multivitamin for pregnancy is folate. Folate's got the most evidence behind it, and it helps with neural tube development. And the ideal would be to be on some sort of supplement with a folate in it at least 6 weeks prior to conception. So knowing that you're either going to undertake an IVF cycle or looking at conceiving in the months to come, it's probably a good idea to start your supplementation early. With the types or the different brands, there's lots of brands out there, and I think it's a tricky one to try and differentiate. Most of the ones on the market have been tested. They're all approved, and they differ just slightly in perhaps some of the doses that they have of some of the other ingredients. Remember also, I guess, that some of the ingredients are only a very small quantities. So when people have deficiencies in particular things like iron or vitamin D, calcium, the amount that's in a multivitamin is probably not enough to overcome those deficiencies, and you'd be looking at needing to get some extra supplementation, but your doctor would probably go through all those things with you if needed. All right, so I guess to talk about some of the things until you start, if there's any questions that you want to throw at me, feel free. Some of the things that I thought I might throw at you are things that I get asked all the time of my patients, particularly with regard to weight and nutrition and diet. I guess at the end of the day, we want all our patients, and I think everybody wants to be in the normal weight range. And it's a matter of eating well. Sometimes we talk about weight loss, sometimes we talk about weight gain. But ultimately, we want you to be in the normal range of weight. And fueling your body in a healthy way is probably the most important thing. So with people who are over a BMI of 25, so we would classify them as overweight or obese if their BMI is greater than that, we start to think about, okay, weight loss, but it's how we achieve that. So it's not about going on these crazy diets where you'd lose like 10 kilos in 2 weeks. To a certain extent, that actually stresses your body more. It stresses your eggs, it stresses your sperm, your body goes into survival mode, and it's not a good thing. And ultimately, as we all know, those type of diets are not sustainable. You will get hungry and you will need to eat. So it's a matter of learning what foods will be good for you and not being hungry, but not overindulging in the bad stuff either. There's lots of evidence out there about fruit and veg, and particularly vegetables. I don't think many people get the recommended daily dose of your vegetables. At the moment, we're recommending 5 serves of vegetables a day, and a variety of those vegetables. So potato does not count all the time. And spreading that over the course of the day is really important. Protein is very important, and there is a fine line in terms of, particularly with red meat. I get asked all the time about red meat. Too much is too bad, but you need some to maintain your iron stores. I have some amazing vegan patients who somehow manage to maintain their iron in a really good way. But one of the crazy things I think that people do sometimes is do these diets where they remove things from their day-to-day. So we're cutting out dairy, we're cutting out gluten, we're cutting out, all red meats. And I'm thinking, okay, well, where are you getting your calcium? Where are you getting your iron? Cutting out is fine if it's being managed by someone who knows how to then incorporate it, the important aspect of that back into your diet. So that's something really, really important, that you get the right things in your diet to be able to make sure your body is not being stressed in any way. In terms of supplementations, and there's a lot written about the fertility diet and what I should be eating for fertility. And ultimately, honestly, for the things that are published, it is eating well, eating healthily, getting enough red meat, but not too much, getting your vitamin D, getting your calcium in your bones is super important, because there is a stress on your bones, and your calcium does suffer in pregnancy because your baby just steals the stores if you're not replacing them. So it's a matter of getting all the right things in. Supplementation really depends on what your diet is like, whether we need extra or not. I think, women tend to be way more on top of their multivitamins and supplementations than men are. Men are very reluctant to take anything. There is evidence out there that, being on a supplement, a multivitamin, antioxidants, does actually help with your sperm. In saying that, if, I've got someone who comes through my door who's extremely overweight, doesn't want to exercise, eats poorly, smokes, and then expects a multivitamin to fix all that, it's not going to work. So unfortunately, in that setting, I have to say, look, this is going to be the hard stuff for you to do. But if, you're not going to change things, we are looking at IVF. We're looking at you needing to undertake this process, which is invasive, particularly for your partner. And sometimes that, even with IVF, the outcome is poor, because the quality of sperm and egg, which we cannot change, that's up to you, will be impacting the outcome. So the hard work, I guess, starts back with you. The other thing to think about as well is, what is it that you want to achieve? Some couples are very happy to go slow, and they have lots of time from an age perspective, from their thoughts on how many children they'd like to have. Other couples will be pressed for time. Age will be a factor. Egg count will be a factor. So I guess how we get there and how quickly we get there is also important to take into consideration, how much of a lifestyle change we're going to achieve and how quickly we can get that without causing detrimental effects. Exercise then sort of comes into play. So when we talk about weight, particularly with patients that are overweight, we need to start thinking about the importance of moving for lots of different reasons. So in couples where one or both parties are overweight, we know that there is extra inflammation in the body. And inflammation, there is some evidence to say that it can affect, in a woman, implantation. So it may have an impact on the lining of the uterus. It may have an impact on the environment in which the egg is growing in. In men, not only does it decrease the sperm count, there is a lesser testosterone level, because with extra fat tissue in your body, there are extra enzymes that convert some of that testosterone to estrogen, and so testosterone levels tend to fall. This can have an impact on erectile function, ejaculating, libido. So all these things, we need to ask about, and, men need to feel open to talk about them as well, because, there are things that we can do. There are things that, we can put into place to help you. Okay. So starting to move is important, and exercise is important. Now, exercising 6 to 7 days a week is probably not the ideal. And research actually says that if you exercise too much, it is a stress on your body, so it's not a good thing. So the ideal or the recommended amount of training or exercise would be about 3 or 4 moderate sessions of exercise a week, with incorporating not only cardio type of exercise, but also, lifting and weight training, because those are really important things that actually help metabolism as well. Okay. So it is something that we advocate, particularly in couples where you've never trained before. It is recommended that you try and get someone to help you through that. So start with a trainer. A lot of people don't like going to the gym, and I get that, but having some sort of supervised training is important, because you don't want to hurt yourself. And if you've never exercised before, or you've exercised very little, I can guarantee that if you go to the gym by yourself, you'll end up on a bike or a cross trainer or a treadmill, and you will do all those 3 machines over and over again, eventually get bored and stop. And they may cause injury. So, learning different things to help your body move is important. On the other side of the coin, I have quite a few patients I see that are super athletes, I call them, people who push themselves to the limit, and this is really part of their lifestyle, and they love what they do. And it is really hard to sometimes say, okay, what you're doing, you love, and you feel great and you feel healthy and fit, but it is impacting your sperm, and it is impacting your eggs and your ovulation. So when your body is at such a high, is working so hard physically, it tends to, the amount of fat on your body, the first thing, is obviously a lot lower than what we would classify as normal, and that can have an impact on the hormones that are sent, or the messages that are sent to the ovaries and testes to actually cause or help ovulation, or help sperm production. So it is something that we need to address and make sure that couples are aware that their healthy lifestyle is actually impacting their fertility. Now, some couples are absolutely keen on changing that to get pregnant, and will pull back on what they do, which is psychologically very hard. Other couples decide, you know what, I don't want to change what I do. And I want to keep doing my training. So how can then we achieve a pregnancy? And it is tricky, because then you are left with, a lot of the time needing to go down the path of IVF. So long term, it is something that you need to talk to them about and say, okay, well, what are you going to do? Because this can still be difficult for you to achieve a pregnancy, even with IVF. Some of the medications, the doses are higher that we need to use to get their bodies working. Sometimes, again, the stress on the sperm and egg can cause issues with the quality of the embryos that are made. But I guess this is where you have to individualize the treatment for the couple, and just make sure you're aware what you want, and what that will mean if you don't want to change where you're at. Okay. So that's a little bit about exercise and I guess weight. Are there any questions in terms of wanting to find out a little bit more about that, or I might move on. So I've had a few private questions come through. Let's tackle some of the dietary questions. We've sort of talked a little bit about diet, and the question, I guess, came through, which is what I touched on before about gluten-free diets. So Again, going back to elimination type diets, I think this is something that's become very fashionable. It's like, let's take this away and let's take this away. And, oh, I feel so much better. I don't feel bloated. I don't feel this. I'm not a gastroenterologist, but, you know, your gut is a very sensitive organ, and it's, as you all know, made up of a ton of different bugs. And what you feed your body feeds those bugs. So basically, if you change your diet, you're going to change that, what we call the microbiome, that bug, you know, system that lives in your gut. And sometimes that initial change will cause symptoms. So you'll have bloating and, you know, flatulence, and your bowel motions will change, and it's normal until your new bug balance actually becomes aligned with what you're feeding yourself. So, you know, when people have never had or have spent long periods of time without dairy and all of a sudden have 3 glasses of milk every day for a week, I can guarantee they're going to feel bloated, and it's going to have an impact on their gut. Similarly with, you know, carbs, there's so many women who just want to cut all their carbs out and cut gluten and cut this. I think, you know, everything in moderation is fine. There are some people who are definitely lactose intolerant, and we've, you know, got to figure out an alternative. Definitely, you know, the celiacs, who we have to avoid gluten, and that's super important for them. But not everyone is going to be in that boat. And as I said, I think just understanding what your body actually needs, and if you're going to cut something out, what do we normally get from that food that's really important for your body that you're not getting now, and how can we source that from elsewhere? And or how can we supplement you? So this is where the supplementation is really important. Okay. In terms of the supplements, particularly for women over the age of 40 or 45, where the quality, we always are talking about the quality of the eggs, and how that's impacted, and what we can do to try and help that. Unfortunately, there's no magic rejuvenating drug yet, but there are people working on it. There are a few things out there that may help. At the moment, a lot of the studies are very much at the stage where we're testing animals. We don't have a lot of really good trials on supplements to improve egg quality in women over 40 at this point, that I can say, you know, this is the wonder drug. So you'll hear about things like CoQ10 or ubiquinol. You'll hear about NAD, which is sort of the new one on the block, and has had some positive research. We hear about resveratrol, melatonin, and then prescription type medications that are androgens. So this is the group of like male type hormones like DHEA, testosterone, that have some research suggesting that it may improve the quality of the environment in which the egg is growing in. Most of those other supplements that I was talking to you about before are what we classify as antioxidants. So what they're trying to do is reduce the impact of all those free radicals that are produced from the mitochondria of the cell, the petrol, I call it the petrol station of each cell. So as we age, that petrol station starts to malfunction a little bit and throw off these free radicals, or if it's not being fueled properly, or if there's lots of inflammation around, or if you're a smoker, there's lots of damage to the cell wall, to the way the mitochondria work. And these antioxidants are helping sort of mop up a lot of that and help the mitochondria work more efficiently to give the cell what it needs in order to grow the egg properly, make sure the chromosomes are dividing well. So there's a little bit of data on in animal studies that these things are actually may be beneficial. So I do always say, you know, do not spend ridiculous amounts of money and coming in with like 15 or 20 different types of supplements. But there may be some things that you may find benefit in. There's also research, for example, for CoQ10, there's good research for the cardiovascular system. So irrespective of fertility, in some families, particularly with, risk factors for ischemic heart disease, things like CoQ10 are actually quite beneficial. Okay, let's talk about smoking, because smoking is a very big factor in a lot of couples, and it sort of tends to be pushed to the side a little bit when we find nothing else in a couple's to try and explain a couple's infertility. I've got some young couples who have come in to see me in their late 20s who've been trying for over a year, and we haven't been able to find anything other than in the history of this, in this particular scenario, the male was a heavy smoker. He would smoke a pack a day, and unfortunately, and it was really frustrating for both myself and his wife, that his sperm count was normal. And so he came in thinking, oh, well, my sperm count's normal. It's not my issue. We know that there's only so much that we can identify on a sperm count. The sperm, you have to then think, are put in a very stressful environment where they're delivered into the vagina, and the only 1% of sperm that gets delivered to the cervix actually travels up and gets to meet the egg. And if it's not strong enough, it won't get there. It will disintegrate. And we know from studies looking at the actual function of the sperm that it has a decreased motility, so it sort of gets a bit lazy, can't quite get up there. It won't fertilize the sperm, the egg properly, so there's decreased fertilization rates in the sperm of men who are heavy smokers. There's less of a chance that even if we manage to get an egg fertilized, that egg will actually stick inside the uterus and grow and become a pregnancy. And even when you do become pregnant, there are higher risks of miscarriage. So all these things go back to being a heavy smoker. And that's really hard to, basically say to them, look, this is what I think the reason is. I can start doing all these other tests, and you're going to spend hundreds of dollars doing a whole batch of other tests that really aren't indicated in this scenario. And ultimately, it will come down to something like that. It's hard. I understand that it's hard for me to, just say, oh, well, stop smoking, you'll be right, and off you go. It is a very difficult thing to achieve. But, in this scenario, more than 12 months in someone who's 27, 28 years old to achieve a pregnancy, I think, you've got to sort of try and think, well, this is going to play a big part. And if we want more than one child, if it's taking us this long now at 27, when I'm 30 or 35 and we want our second or third child, it may almost be impossible. Okay, so and start early, start thinking about these things early, because these lifestyle factors, as benign as sometimes you think they might be, they're not so benign. Okay, in terms of other alternative types of medicines out there that people look towards, like Chinese medicine and acupuncture. Look, it's really hard for Western doctors to talk about Chinese medicine, because they view the body in a very different way. And as you know, if you go and see an acupuncturist, they will talk about meridians and how the body sort of flows, and how the foot is connected to the uterus, and so the way that they see the body is in a very different way. We have some studies looking at acupuncture, showing that acupuncture can increase blood flow, for example, to a uterus. We have other studies that say it makes no difference in terms of your outcome, your pregnancy outcome. I think ultimately a lot of these alternative things will come down to what you believe and what impact it's having on you both physically and psychologically. You know, there is a massive amount of new research into the psyche and the you know, stresses on our body, both emotional, physical, that can affect fertility. I tend to direct my patients to a documentary that IVF Australia actually sponsored on its premiere called The Connection. And it's a really fun, interesting documentary that talks about the effects of meditation on the human body, but not just, oh, it relaxes you, you feel better. It's like, what's the science behind how meditation decreases your chances of, you know, getting blood pressure issues or getting cancer, or how does it improve fertility? And it looks at the science behind, you know, what we think is happening in our body when we ask people to become stress-free. There's a nice section in there about fertility and how a particular unit in the USA set up a support group for women undertaking IVF cycles, and how meditation actually helped them achieve a pregnancy much faster than those who weren't in that group. And there wasn't any significant difference. All the women were going through IVF. So it's quite interesting how something that you think is just there to help you cope through the process is actually helping you achieve your goal at the end of the day. So I don't discard any of these alternative, we call them alternative types of treatments. I think, you know, our understanding of them is poor. We you know, as Western doctors, we can give you very little advice because a lot of what they do is done by viewing the body in a very different way. But I don't feel that it's something that you tell people, oh, don't do. If it helps you, absolutely, go ahead and do it. With respect to other things that, you know, people do on a day-to-day, so caffeine is a big one. Let's talk about caffeine. I get the question about coffee all the time. The studies vary a little bit. We know that if you're having more than 5 cups, 8 cups of coffee a day, then this will definitely impact your fertility. Now, a lot of people don't realize that caffeine is not just in a cup of coffee. We're getting caffeine, you know, in green tea. We're getting caffeine in, you know, a lot of people who are doing training and taking pre-workouts. I mean, pre-workout has a hefty amount of caffeine. Most of them do have a hefty amount of caffeine in them. So you need to take all those things into consideration because they're impacting your fertility. And we know with increased amounts of caffeine, when it's excessive, it takes longer for you to achieve your pregnancy by up to 9 months. And if you're drinking more than 5 cups of coffee a day whilst you're pregnant, there are some studies that show this increases your rates of miscarriage. So, you know, when you're a ridiculous coffee drinker or caffeinated person, you really need to pull back. But having 1 cup of coffee a day is not going to make a difference, okay? So, you know, a standard cup of coffee a day is fine. Most people tend to cut that out, and, you know, that's okay too. It's obviously less is better. But, you know, 1 cup of coffee is not going to cause all these issues. In terms of other types of drugs or medications that people are taking as well, you know, I get asked as well about illicit drugs, you know, when we take the history about, okay, well, what have you been on? Now, in the past, how long, how much, you know, everything from illicit drugs, things like marijuana, cocaine, heroin, obviously are all going to affect your fertility. Sperm count is affected, fertilization is affected, higher rates of miscarriage. All these things will long-term have effect on, you know, testicular function and libido and, you know, egg reserve. So you've got to be really careful with the party drugs as well. So some people party hard for a very long period of time, and that can have a detrimental effect when you come at, you know, the age of 38 and you've settled down, you know, having had a lot of time with those party drugs can affect your fertility long term with egg count and egg quality. So it is something that's hard because, most young people are not educated about their fertility for the future, don't feel like these things are impacting their fertility, but they do, and you do need to take that into consideration. Similarly, a lot of men who come in, in their youth, when they were 19 or 20 and they were going through their bodybuilding phase, were given anabolic steroids or growth hormone or testosterone, and they may have not taken it for extended periods of time, but the impact of those types of medications can prove quite detrimental, and not everybody has the same response. So long-term use, we know, basically just stops sperm production altogether. Some men get spermatogenesis again, so they can start to make sperm again. Some men never resume sperm production, and even though they're told, oh, we can give you these injections and it'll just start things up again, it doesn't always work. So it's being very careful about those type of things, and one of my big passions is educating young people about what's going to affect their fertility, just so that they're aware. And it's not, oh, don't do this, don't do that. It's like, if you do it, this is what you need to know, and protect your fertility and do your checks. A lot of the preventative type things out there that we know help decrease infertility is just a regular checkup by a doctor, going to see your GP or a gynecologist, or someone who's sort of asking the right questions, maybe probing you to think about what you're doing in different aspects of your lifestyle that may affect your future health, which will include your fertility. So a regular check for anything, just going to see a doctor will actually reduce your infertility rates, apparently, later on down the track. So it's not a bad thing. You need to consider hobbies as well. So there are lots of sort of hobbies out there that will impact fertility. So particularly cyclists, men who come in and they love to cycle. Those who cycle more than 5 hours a week have been shown to have a reduced sperm count. The impact of that seat on those testicles, the heat, all those factors will cause a decrease in your sperm count and motility and morphology, so what they physically look like, and therefore will have an impact on fertilizing an egg, implantation, and actually achieving a pregnancy sooner rather than later. Some people have saunas in their house, or hot tubs. Not as common anymore as what they used to be, but these are things that, particularly with men, are going to affect their sperm count. The testicles are outside the body for a reason. They need a lower temperature than body temperature. So when you heat them up, it's not a good thing. And the whole boxer versus brief discussion is all about that. It's making sure that they're not too warm all the time. So not sitting on your butt all the time. You've got to get up and move around and air the guys out. So if you like to sit in a hot tub every day for 2 hours, your sperm will suffer for it. So taking into consideration the day-to-day of what some people do, because we don't always ask about these little things. I mean, I know that I don't ask whether you've got a hot tub and whether you sit in it all the time, or whether but it is important to know what people's hobbies are, what your work environment is like. Work environment is really important as well, because some people are sitting down all the time. Some people are outdoors but working with pesticides, gardeners. Some people are working with cement, toxins, painters. So understanding a little bit about some of the chemicals that are used in these scenarios is really important, because you find that it can definitely affect sperm. And we probably see it more in men because we can test sperm. Can't necessarily test eggs so much. And men are making sperm every 72 days. And so the turnover is great. And the good thing about that, obviously, is that if we take that that toxin away. Hopefully, in a healthier environment, we get, good sperm production, and better quality sperm being made thereafter. I think at some point we were going to talk about other types of prescription medication as well. So I had that down to have a chat about. So there are lots of couples who come in, particularly when you're a little bit older and you start to have issues with blood pressure and cholesterol, and you start being medicated for these things, and everything seems like, I'm under control now. And then you come in and I'm like, well, that cholesterol medication is going to affect your sperm, and that blood pressure medication is going to affect this. So this is where it's really important for us to take into account, you as a whole, trying to work with your specialists as well, so that we can say, okay, do we need to change this? Can we change it? And if we can't, how can we improve, the outcome with what you're currently on? But it is important, particularly with some of these medications, if your GP is talking to you about being on, cholesterol medication, you're thinking about having a family, all these medications are important. And sometimes it's really good if you can make a list of everything that you're on, because, when you come in to see me and someone tells me, I'm on that little blue pill, Alex, the one that helps you with blood pressure. I'm thinking, oh God, there are lots of little blue pills out there. And if you start telling me this now and you're only in your 30s, I can only imagine what you're going to be like in your 70s. So start writing stuff down, all the supplements that you're on, the doses that you're on. Some of the brands will help, because that way sometimes there are things that, are a bit obscure, so we look them up as well. So it's really important to know exactly what you're on, what you're exposed to, because these can affect, your fertility, your eggs, your sperm. There are other things out in the environment that are starting to show an impact on our hormones as well. So, there are some things out there called endocrine disruptors, which basically just means they interfere with our hormones. At the moment, the studies are quite in their infancy. We're seeing the, animal studies, where we can identify, for example, makeup, the things that are the things that are used to make, lipstick and eyeliner, and how that can affect your hormones. At the moment, the studies on humans haven't shown any detrimental effects, but there are effects on our hormones. So, there's a lot out there about, BPAs, and, women come to see me and say, oh, do I have to stop wearing lipstick and makeup? And it's like, okay, well, how much are we going to do? Can I laser? Can I get my nails done? Can I do this? Can I do that? I guess at the moment we don't know what, how much of an exposure. Obviously, the more you're exposed to these things, the more we think they're going to have an effect. Going to get your nails done, once every few months is probably okay. Getting your hair done is probably okay. But, if someone's working in that environment where they're exposed to all these things every day, that's when we start to wonder whether, it is playing a part in their infertility, if they're coming in with infertility. All right. So are there any questions out there at this stage? I think we've gone through quite a few different things. So we've talked about nutrition, we've talked about weight, talked about exercise, supplements, smoking, caffeine, hobbies, drugs, prescription drugs. I guess, if there are young people, educate them about their fertility, super important, because age is probably one of the biggest factors that causes infertility. So it's basically just understanding how your body's functioning, what you're doing, and what you're exposed to that can impact, and being, I guess, to a certain extent, willing to accept that there are some things that you may change that will actually, improve your fertility. There's no magic tablet that we can give you for some of these things. It's just hard work on your part. but it does pay off. It does pay off both for fertility, for pregnancy, and then when you're running around after a toddler and you've lost that extra 20 kilos that you had on you, you will be very grateful. So I might just wrap it up there and say if there's any particular questions you have, feel free to call our 1-800 number at IVF Australia, contact any one of our fertility doctors. Even chatting to them about normal fertility sometimes is a good thing. So you're aware, in the future, if you're not looking to get pregnant now, what you need to look out for. So lovely to see everyone on, and hopefully we won't see you too soon and you'll get pregnant on your own. And we'll leave it there. Thanks, everybody.